So a significant emphasis in my practice is treating skull-base tumors, or tumors that occur at the bottom of the skull where it meets with the neck. So the first question is, what's the skull base? So if you take a skull and you look at it from underneath, and in this particular model, we've taken the jaw out, and you can see there's all these little holes and openings. So this is where your jugular vein comes in, which drains all the blood from your brain down into your neck and into your lungs for recirculation. This is where the carotid artery comes through. That brings all of the blood to that side of your brain. If you get up here, this is the foramen magnum where the spine comes through, and every one of these little holes has a nerve or a blood vessel that comes through it. And there's a whole series of tumors that can occur down here. And so we work a lot together in this area with our head and neck cancer colleagues to remove bone to get them to very difficult places. So if you could imagine if you had a tumor down in your skull base, what we call the parapharyngeal space, it'd be very hard to get there without damaging the facial nerve, the carotid artery, the jugular bulb. So what we do is we drill bone away to give them better access. When you turn the skull around, the other part of skull-base surgery is that piece that occurs in the brain cavity. So this is the posterior fossa of the brain. This is where the big sigmoid sinus comes down and becomes that jugular vein we talked about. Your carotid artery comes up through this opening, and this is right where your optic nerves that give you vision occur. And this is what we call the clivus, where the two temporal bones, which house your ear structures, come together. So this entire area is very difficult for a neurosurgeon to get to. So oftentimes, I will come in as a skull-base surgeon and I will do the bony work to make it so the neurosurgeon doesn't need to put a retractor on the brain. Anytime you put a retractor on the brain, you decrease the amount of blood flow to that area, and it runs the risk of swelling or even having a stroke. So it really minimizes that. And these are very complex operations. These are operations typically done by someone who's done a neurotology fellowship. And on this side, we're usually working with neurosurgeons. On this side, we're usually working with head and neck cancer surgeons, and sometimes we'll bring the neurosurgeons in as well. So these have significant risk for complication because of the intensity of the anatomy, and it really requires a very specialized understanding of the anatomy to be sure that we avoid the structures. So as an example, 70% of the lymph nodes in your body occur above the clavicle. And so when you get into the neck region, into the skull base region, and into the posterior fossa, it is a very highly dense area of critical anatomy of nerves, blood vessels, and neural tissue, whether that be spine or brain tissue, that's very important to preserve. And that's where the neurotologist and skull base surgeon is very useful.